And then most recently, my mom's taught me how to die. I've always been fascinated with how we deal with death in this country. And her death really did teach me a lot. It was a very formative part of my last year. I mean, any death, especially of someone that you love, is a tragedy, right? There's predictable tragedies in your life. Like most of us are going to have to say goodbye to our parents, right? Fingers crossed, not many of us will have to say goodbye to our children, although it does happen. And I think that it being tragic and you feeling emptiness and sadness is just really part of that human condition. It's part of life, and it's part of the maturing aspect of life. I was never really an adult until I had kids. That's how I feel of it, right? And, because kids have taught me so much, and your brain changes when you have kids, right? There's, you're no longer the center of the universe, and rightfully so. I think your brain changes also when you lose people that are close to you, and different ways for different people. I think my mom's death has made me kinder. Maybe a little less ambitious, but definitely kinder. I think a lot about how to treat people better. So that's a blessing. Now, in terms of what happened, I mean, I think it's a story that's worth sharing. I mean, not that it's easy to share, but, maybe therapeutic. Who knows? So my mom was very healthy. She was, an extremely vigorous 74-year-old. And she actually did not first get sick with COVID. She got sick with a hip fracture. She was walking with my dad and turned and fell and broke her hip. And she had a rather unremarkable surgery, was sent to a rehab facility. And it was actually at the rehab facility that she got COVID. So just part of kind of just that was the first tragedy, that she broke her hip. The second was that she got COVID because, in medicine, sometimes we don't do the best about screening people or, making sure that people, aren't working when they're sick. I mean, universities do a better job in screening people who have COVID, and the NBA and all these other places screen patients regularly for COVID. And in medicine, we've decided it's probably a little better that we just put our heads in the sand. And you've had this experience, right?
Yes.
You've never been tested for COVID once while working as an ER doctor, nor have I. So my mom got COVID at the rehab. And at first it did really well. Looked like she was doing good. And I was actually going to fly home to take care of her and help her with some of her rehab because her time in inpatient rehab was ending when she became profoundly hypoxic. And we've all seen this with COVID too. People putter around for a week or two and then boom, they just friggin' fall off a cliff. And that was definitely the case with her. And my mom was pretty critically ill for around a month, back and forth to, first in the hospital, then in the ICU. And I went out to visit her for around a week the first time she was in the ICU. And I'd say that the biggest privilege that I've had is the fact I was able to see her. Because we know so many families are robbed of that opportunity to spend time with the people that they love because of COVID. And because of my stature as a physician, I was allowed access and had the PPE gown and everything every time I saw her, but was able to spend a lot of time with her. And man, she was strong. She wore BiPAP on her face for I think like 10 straight days. Had everything that happens when that happens, skin breakdown on your face, etc. But she would never complain, And then we weaned her at one point to high flow nasal cannula. And she was actually able to talk with me for a little bit. And we had some great conversations. But I asked her once, do you think you're going to die? And she said yes. And that was, I think, one of my first, when she was on BiPAP, I asked her that. And she said, she nodded to me yes. And that was one of my first indications. And then, she looked like she was going to survive. She had been titrated heated high flow. We're working on titrating that down. And I left my mom's hospital to go back and spend dinner with my dad. And then I got one of those calls, probably an hour afterwards, that my mom's heated high flow nasal cannula had become dislodged or was taken off. Who knows? And after that she had a respiratory arrest and had been intubated. So I went back to the hospital to an intubated mother, wondering if she was, how she was going to do. And I asked to see the rhythm strip, and, because I know what that is, and the pulse ox. And the saddest part of that was my mother had removed her oxygen and had become hypoxic probably 2 minutes afterwards, but it had not been recognized, and a code had not been called for around 30 minutes. And I think about that a lot. What that time must have felt like. I was pretty angry. I think I was rightfully angry sometimes. But that in an ICU that someone can be hypoxic for that long and be allowed to die was a bit of an abomination. And I think that taught me a lot about anger and about resentment and about how toxic that is. That night, I remember just laying in bed and being like, I'm, just going to sue the fuck out of that. And I'm going to try to get everyone's license. And, the fact that my mom was allowed to die for 30 minutes before I was recognized. And I realized that that's not helpful. It's not the way that I would want to be treated if I made a significant mistake. And I don't think that's what my mom would have wanted. She would not have wanted revenge. My mom, and I know this, ultimately cared deeply and was very thankful for the people who cared for her, the people who made a mistake, an honest mistake. So I learned a lot about mercy and grace and forgiveness, and how important those things are. Ultimately. So that was a tragedy. My mom survived, on an ET tube for probably another 10 days. I flew back home, but I kept in touch with her doctors. And, I would always ask them. They'd give me all these reports. And this is one of the big cardinal sins around medicine, right? Is we want to talk medicine. And at least I'm a doctor. I can talk medicine. I really didn't give a shit what my mom's creatinine was or what her pressures were or whatever. I cared about the things that meant something to my family and meant something to my father. Is my mom going to survive? Is my mom brain dead? What does her future look like? And, I talked with all these doctors who were, I don't know. And then I talked with a doctor who said, I really don't think this is going to go well. And I said, well, if it's not going to go well, I know exactly what my mom wanted. She didn't want to be hooked up to a machine. So I flew home and got off a plane with my brother, who was thankfully in town from Singapore. And I went to my mom's, to the hospital the same night I flew in. And I talked with the doc, and I sat by my mother. We weaned all her sedation, and I terminally extubated her. Not the respiratory therapist. It was, I thought it was important. She gave me life. And on the other end of that, I wanted to give her a good death. So we terminally extubated her. And, surprisingly, she did great on nasal cannula for a while. She, we had a good conversation. She was too hoarse, but she knew why I was there. And she knew why I was there. She knew that it was time. And we spent a good few hours together. Now, at the end of it, I think that she became a little too hypercarbic to mentate well. But she was still satting well. And I knew, we'd given her a few doses of stuff for anxiety and for air hunger. But it was really hard to take off that he did high flow, and I was with my mom. Like, we are the only two human beings in that room for hours. But I still needed to call someone to say, is this okay to do? And I'll be forever in debt. Dr. Warner was the one who helped really kind of ferry me and my family through a lot of that. And I'll forever be in debt to her because she's the one who reassured me. She said, it's okay. So I moved her heated high flow and I held her. And she died in my arms, which was a blessing. A good blessing. So yeah, that's how it happened. And I appreciate the opportunity to share it. And if someone gets some good for it, then it's worth it.
I know there will be. There's a country that's got families and loved ones of over 500,000 people who have similar stories.
And that's the biggest tragedy, right? It's the fact that people didn't get to say goodbye. The fact that so many people died alone. And I think about that oftentimes. One of the things this has made me better at is calling families. I think all of us have felt that inconvenience, right? You're just trying to get through and practice medicine and, do all of those things. But the importance of actually reaching out and calling a family member, that's a lot more significant than it was before. Because I've now been on the other line where I know what it's like to feel like an inconvenience. An inconvenience to get an update, an inconvenience to, talk with a nurse or with a doctor who I know is just busy as hell. But at the end of the line, that family member is worried. They're suffering. They want to be there even though they can't. And COVID's robbed a lot of people of that. And it's a great tragedy.
Thank you, Don.
Yeah. Are we going to end on something happier? One thing, we originally started down this track because it was about end-of-life care. And I do still feel like we do that so terribly in medicine. And some of it, I went through with my mom, is that we're not willing to have honest conversations with patients whose family members are dying. And there's a concept in Buddhism about what's called idiot compassion. And I see it as a mistake that's being made oftentimes in terms of pain control, in terms of end-of-life care, right? Where it's easier to tell people a nice lie because you don't want them to suffer than it is to tell them the truth. And that concept of idiot compassion means that you're actually prolonging and worsening their suffering when you don't have I'm not sure the right term, backbone, when you don't have the honesty to tell people the truth. That's a tremendous disservice. And I've seen it happen time and time again, right? Where there's someone who has a subarachnoid hemorrhage that they've got hydrocephalus and, the surgeon looks at it and they say, well, this person's dead. And then what you do is you offer them surgery. To what ends, right? Or the person who we all know is moribund and, we still do things to that person. And, that comes at a tremendous cost, not only to our medical system, but I think it comes at a tremendous human cost because so often when a person's in an OR or an ICU or something else, they're not with their family.
They're alone.
Yep.
Yep.
And really, to me, we have to make death much more human again. We have to let people know the options, but also know, hey, this is your family member. Your family member is going to die. And the trade-off between a Hail Mary and allowing them a natural death might be the fact that you don't get to spend any time with them. And to refocus people, because I think, it's always funny. People want to play doctor when it comes to end-of-life care for their family. They don't know what a creatinine is. They don't know what a pressor is. They don't know all the medicines we're doing. But suddenly there's this deep interest in Googling all this shit and saying, well, what if we do this and what if we do that? And And really, you just have to refocus. And I tried to do this with myself all the time when I was with my mom in her final days, is I said to myself, I'm here to be my mom's son. Do I have a good amount of medical knowledge? Yes. But am I going to question the vasopressors we're using or question this management? A little bit. I did a little bit. But really, my principal purpose was there to be her son. And that's really, I think, one of the things we can tell family members too, is, I'm happy to be your loved one's doctor. I went through a fuckload of school to do that, in fact, right? And have a good amount of experience doing that. But what I need you to be is I need you to be the husband, the son, the daughter, the family member that your mom would want in a time like this, right? Or your family would want in a time like this. And I want to tell you how important it is for you, for your soul, for your well-being, to be at that bedside and to tell your loved one how much they mean to you, to tell them sorry for anything that you've done wrong, to tell them thank you, and to tell them I love you, right? You only get one shot to tell someone that on the way out sometimes. And we rob a lot of people of that shot, So it's made me a lot more human about death. I was already kind of fascinated with this stuff and passionate about it because I thought that we fucked up the human component of dying a lot. But it's redoubled those efforts, Giving people good deaths, a death like my mom had, should be one of the biggest goals of medicine. Not the foolhardy goal that everyone's going to live forever. We've succeeded in making no one live forever. But we sure as hell can succeed in making people's quality of life as good as it can be for as long as it can be. But then when the time has come, to give people human deaths.
There's no more important calling. I couldn't agree with you more.
Yep.
If time were short, what would your family member want to be doing, and what would you want to be doing with your family member?
Yeah, exactly.
And time is short.
Mm-hmm. And that's a lot harder to do than to say, well, they're going to surgery. Or, well, we started them on this vasopressor and they're going to the ICU.
That's safer. It's safer for us. It's more comfortable.
I don't know if it is safer for us. Right? I would have been less angry if they would have told me we made a mistake. Mm-hmm. Right? Initially. I mean, I'm no longer angry. If they said, listen, your mom's been hypoxic for a while. We don't know what happened, but the alarm was not heard or not listened to, and we've made a mistake, I would have been less angry. Right? So I do think that, I guess it gets back to the concept of being honest with people, right? I think oftentimes we try to soften blows that are devastating. The death of someone is a devastating thing. There's no softening that, right? You can give the news in a compassionate way and then refocus on what's going to be less traumatizing for that patient and that person as they move forward in life. Not giving them a bunch of idiot compassion and hoping that things turn out for the best. Thank you for the opportunity to talk about, things that are important. We don't have enough important conversations nowadays. So it's good to have one every once in a while again.
The privilege is mine, and the privilege is our listeners for the chance to share in your vulnerability. It's raw, and despite the efforts that you clearly have taken to process it and to deal with it, but it's raw, and it's pain, and it's such a tragedy, and it's vulnerable, but it's a beautiful story.
Oh yeah.
It's a beautiful story with a beautiful ending, and one that I'm privileged to hear.
Yeah.
And
it's got good lessons, good lessons for me as a physician, for me as a human being. It's a tragedy, no question. But it's a tragedy that's made me a better person.
You said you wanted to end on something brighter, and there it is. There it
There you
is, right there.
Yep. Good allegory for this year, right?
Yeah.
It's this last year, this epidemic is a tragedy, but hopefully it makes us better people, a better nation, um, better caregivers, better doctors, and healthcare workers. I really hope it does.